Time for our regular look at health, and it's a virus that flies under the radar for many, but RSV is a leading cause of hospitalisations for babies, as well as being a serious illness in older adults, pretty prolific among younger kids as well. This winter, however, marks a turning point with 2 vaccines and a new treatment for infants as well. To walk us through it all is paediatrician and infectious diseases expert, Dr. Linny Fuong. Good to see you, Linny. Let's start with the basics. What is RSV? Why is it such a concern, and why is it a bit of a sleeper virus that few of us are aware of?
Yeah, good question. So RSV is Respiratory Syncytial Virus. It's a really common virus actually, and it's probably getting sort of known a little bit more now because people are testing for it more. We're starting to see it on, you could get the little rat kits with RSV, flu and COVID now. So certainly people are a bit more aware of it. In terms of the virus, as we said, it essentially affects older people more and younger people more. So it certainly is an issue in young infants, particularly those under 2, especially those under 6 months. And so this winter, hopefully with some new sort of preventative therapies, it's going to sort of, reduce the risk here. And so certainly what we're seeing is with RSV, it causes inflammation of the airways. So upper airways and lower airways can lead to bronchiolitis. And so there are hospitalisations as a result of that. And so, yeah, that's...
I know a few babies who have been hospitalised. It's a horrendous thing. There is some more protection now, though.
Yes.
This has become maybe more on the public agenda off the wake of COVID.
Yeah, that's right. So certainly what we saw in terms of numbers is that around about 12,000 people are hospitalised every year with RSV. And so nationally last year there was 175,000 cases. 50% of those were in children less than 4, and then we saw another 15%, so a large proportion in older adults. And so we are seeing a large sort of burden of disease. And so that's why these preventative therapies are really important.
One of my little guys got it a couple of years ago, and we spent a few nights in hospital. It was really scary, and it was the first time I'd heard of RSV, and it did turn into bronchiolitis. That's the one.
Yeah.
This winter is different with a couple of additional protections for families. Talk us through these.
Yeah, so in the last couple of years or so, we've seen there's an older person's vaccine for over 60 years of age, but now there is a maternal vaccine, so a vaccine that we give to pregnant women to be able to protect their newborn babies. And also we've got a long-acting, I guess called an immunisation product, which are preformed antibodies that we're giving to newborn babies and children in their up to their second year of life to protect them against the consequences of RSV.
Would you recommend testing your kids if they've got a bit of a cough or they're not feeling well?
Yeah, this is a really good question. I think it's been talked about a lot at the moment because, as I said, like the rats exist, and so you can kind of test and figure out perhaps what it might be, where they need to stay away from, and potentially which way it's going. I think it's a good question for clinicians as well, because we often think, we don't want to do the test unless it actually leads to a change in what you're going to do about it in terms of management. I think it's useful in some scenarios. That's not a very straightforward answer.
Okay.
Yeah. Okay.
If you're a parent or a carer wondering if your child, maybe your elderly parent, might be eligible, maybe they should be getting this, what should you do?
Well, always speak to your healthcare professional and figure out whether or not you're eligible and whether or not it's actually going to be of benefit to you. But certainly it's exciting that we've got these game-changing treatments available now. Hopefully that'll mean that we have a better winter, hopefully.
Yeah. Fingers crossed.
I
think we all need that.
Absolutely.
Dr. Linny, thank you so much for taking us through that, and we'll see you soon.
Thank you.